we can, what do you suggest, Ulrich? We can already start. I mean, just the...
Yes, I think we should start out with the introduction.
Okay. Good afternoon, everybody, wherever you are, back in Denmark or here in Germany. Together with Ulrich, we are organizing this Industrial Campus Camp, and today's first destination, as you see, is Mannheim in the state of Baden-Württemberg, the virtual destination, of course. And today we will be together with M2OLIE, which is the institute in Mannheim, and they are Professor Dr. Patrick Meyer is together with us and his team, together with Laura and Simone and the esteemed speaker. Together we will be discussing and reflecting on industrial and campus partnerships, especially focusing on the M2OLIE model and how they work there. Apart from that, as you may all know, Ulrich is our Council and Research and Innovation Attaché here, and we will be co-moderating this session. And our esteemed Danish delegates are from both public and private institutions back in Denmark. Ulrich will give them a detailed introduction later on as we proceed. So just a few technical details for you towards the end of the session. We will have a Q&A round where you, as Ulrich also mentioned, will be able to click on the raise your hand button as if you have a question, and then we will relay your questions from here. This will make it easy for us to take your questions one by one. I would also like to go through the agenda for today very quickly.
Sonali, it seems that on my screen I cannot see the agenda yet, but
yes,
I think working on that.
Yes. Come on. It's not letting me do the...
But I can do that. I have the presentation as well.
Yes. Can you see it now? Yes.
Yes.
Okay.
Yes.
So just briefly, I will soon give the floor to Ulrich, and he will give a short introduction about Innovation Center Denmark, what we do here, what this program is about, and also a brief introduction of what the Danish delegation represents. And soon after that, we'll give over the mic to Professor Dr. Patrick Meyer and his team, and followed by the speakers. And followed by that, we will get some idea also from the Danish perspective, where Professor Dr. Jakob Benson from the University of Aarhus will share his perspectives with the innovation ecosystem at their university. And like I mentioned before, towards the end, we'll have the discussion session where you can raise your, and I would highly encourage our esteemed participants to have a very engaging session towards the end. With that, I would like to hand over the mic to Ulrich, who seemed to be away.
I'm here.
Okay.
And
I can stop sharing my screen.
Yes, and then I would share basically the same presentation. This I will just find. 1 second. Maybe you, Sonali, you can continue to share the presentation, because it doesn't seem to work in my end, but it's the same presentation in any case. And I just wanted to say a few words about Innovation Center Denmark. So this is probably not so new to the Danish participants, but still a little bit new to our German meetings partners from M2OLIE, and we're of course very pleased that you are here. It's been a long process, and we've had several meetings. I've been pleased with that, but I'm also happy that we now have the actual meeting here with the Danish participants representing different universities and industry representatives as well. So for those who are new to this, I represent Innovation Center Denmark. It is a partnership between the Danish Ministry of Science and the Ministry of Foreign Affairs, and we are based in 8 locations around the world. And as you can see on this map, there's only one Innovation Center Denmark, and it's located in the southern part of Germany. I'm sitting here together with M2OLIE in Munich, but we are covering the DACH region, but I would say the main focus is on southern Germany and the innovation ecosystem here. And one thing that characterizes this innovation ecosystem is the very close collaboration between universities, research institutions, and private companies. And this is something we've wanted to put a specific focus on. Therefore, we are very happy to engage with you, M2OLIE, which is actually such a partnership. But just a few words more on Innovation to Denmark. So, Nadia, if you can go to the next slide. Yes, as mentioned, it's a partnership between the 2 ministries, and our role is to link the Danish innovation ecosystem to partners in southern Germany and in our hotspots. And in this case, we're focusing specifically on Baden-Württemberg and some of the very interesting public-private partnerships here. If you can go to the next. I will just, and the next again, I will just say a little bit about the Danish, one back, a little bit about the Danish delegation. I haven't taken all the names, but just for you, representative from M2OLIE, to know that it's actually a representative from many Danish, most of Danish universities, and also private companies, as outlined here. And they all, in some way or another, work with innovation processes, technology transfer, and we have had a previous discussion on different partnership models, on business models. How can you make this partnership works? What challenges are involved when you work so closely together between universities and private companies? What different partnerships are out there? And at least one point from my side is that we see a lot of interesting partnerships in southern Germany, and we also in some cases see a very close collaboration, and some cases even closer than we see in Denmark, especially because the mobility of researchers is quite high in southern Germany between universities and the private side. If we take the next slide. I just want to mention that this is our first meeting with meeting partners in southern Germany as part of this camp. We had a meeting this morning introducing the topic of the 3 days, and also a very, very short introduction to you, but you will of course go more into detail about that. Then I just wanted to tell you that we have the meeting with you today. Tomorrow we are meeting with the Cyber Valley initiative in Tübingen, so a different topic, completely different topic, artificial intelligence. And on day 3 we are meeting with the Schäffler Institute at campus at Karlsruhe Institute of Technology, focused on the future of mobility. So this is part of our virtual meeting program here. Next one. And as also discussed with Professor Meyer and good people in Mannheim, this is a program where we want to make the interaction between the Danish delegation and the Danish innovation ecosystem closer to the southern German partners. And it's an invitation to take up future collaboration, either bilaterally or together. But this is an invitation for both sides, I would say. Yes. And just one final slide from my side. These are some of the topics that we have previously discussed throughout the year, since we've had two preparatory meetings on this topic. We have also, some of us met with another partnership in Karlsruhe called the Karlsruhe Service Research Institute, where IBM and Bosch are working together with the university there in a partnership model. And these topics highlighted here are some of those that have come up and would probably also be an interesting. Some of these themes would be interesting to discuss when we have our exchange after the presentations. And I can say that the part about business models, or how do you make a collaboration model that is equally that creates equal value to both industry partners and the university and the public side, that's something of interest, I would say, in general terms. I think that is it from my side. Then I would give the floor to Professor Dr. Patrick Meyer, who is the director of M2OLIE, and who will explain more. So thank you for joining, Patrick, and we are looking forward to your presentation.
Okay. Now, about. I have a problem. I have I cannot give the desktop. It's a little bit problem. I have to try on computer. Now I've okay. Normally I work with WebEx, and I think WebEx is a little bit more okay.
I don't know if one of the colleagues of Professor Meyer has the presentation as well, then we can do it.
No.
Okay.
I tried to load.
Otherwise, you could send it to me via email, and I can just quickly check if I can share my screen.
Yes, that would be great.
Can you see it?
Yes.
Okay, so I'm basically able to share. If you send it to me via email, I can do the presentation for you.
One more.
But maybe I can say something meanwhile. And that is that we have had a few meetings with Professor Dr. Patrick Meyer on this topic. So, and we have discussed, that it would be interesting to learn a little bit more about this partnership. And what I learned, at least from one of our discussions, is that M2OLIE is a partnership partly funded by the German Ministry of Science as part of the Research Campus program. So there's an incentive to have this public-private collaboration. And whereas research is of course a big part of this partnership, other things have also come out of it in terms of startup collaboration and other types of innovation activities. So maybe we'll learn something about that as well.
Mr. Shepard, did you get my email?
Not yet, but I think if you send it out, it's a matter of seconds, hopefully.
It's 14 megabyte big.
Okay. Yeah, shouldn't be any issue, but I will let you know once it is there. Yeah, now we got it. Just a second.
And Professor Meyer, then you can actually request control of the screen and then present it yourself.
What I can
request
get
control. Ganz oben.
How can I get the control?
I can also see the list, but Professor Meyer is unfortunately not in the list of people I can give control to. So probably it is linked to the issue that he can't share.
The next slide.
Yeah, I will. You will just let me know, and I will.
Okay, here you see the map of Germany. Now we have actually 9 different research company in Germany. We have two in Baden-Württemberg. It's called M2OLIE, and the other one is Arena 2036, which has a topic of the automobile of the future. And all these 9 research companies have different topics. 3 are on the way in life science and medicine, which are M2OLIE, Stimulate here, and infectognostics, and the other deal with different topics. On the next slide, you see some facts about M2OLIE. It's funded by the Federal Ministry of Education and Research. It started, the project application was in 2012, and we had a project start with a pre-phase of 15 months in 2013, then the first funding period for 4 years, and then starting in the last summer, the second funding period for 5 years, and probably in 2024, or at least in 2025, hopefully the third funding period of additional 5 years will start. And we get about 2 million euro per year, and all of our partners have to give additional 2 million euro per year. It's not required to give this funding in kind of money, but also in personal. So that people will be sent to the research company, or material will be given, or machines. And the main part of the research is located at the University Hospital Mannheim, which is seen here. And on the next slide, you can see this in another map. So with the circle on the left is the M2OLIE Center. We got 2 years ago a whole floor in one of the buildings in the University Medical Center Mannheim, which is now used by M2OLIE with several offices, and also the administration office has its place there. And in blue, you see the sites where therapy is done, in red where the imaging is made with different techniques, so MRT, CT, or PET-CT, and we have also preclinical research on the campus. And very important, this dark gray building here in number 41, the number is not here, it's above 42. It's the QBEX, probably Professor Dr. Bourdon will also tell something about this building. And here's our interventional room, so our experimental room located, driven by the Fraunhofer Institute. On the next slide, you see something about the structure of M2OLIE. So our vision is that we will be able to cure cancer despite of metastasis. You will see on one of the following slides that we don't want to cure persons with metastasis on several sites, but so-called oligometastatic disease, meaning that we have one primary tumor and several metastases only in one organ. And this is the aim of our treatment, is that each metastasis is be treated individually, and this will be done by automation and robotic assistance, which will increase the efficiency, precision, and also acceleration of diagnosis and therapy in a closed loop process. On one of the following slides, I will show you what the closed loop process really means. And so we will build in the next so where the patients with oligometastatic disease will be treated. And here you see the fundament of this hospital of the future, and where the academia and industry are working together. And on the next slide, you will see the different partners in M2OLIE. So we have now 28 partners, and additionally the city of Mannheim is also supporting the M2OLIE. So in orange you see the university partners, surrounded by red, the partners of additional academic research institutes, so the German Cancer Research Center and the Fraunhofer Gesellschaft. We have the University of Mannheim, the Heidelberg University of Applied Sciences in Mannheim, and also University Hospital in Bonn, together with the University Hospital in Mannheim. So we have two different hospitals where we can build up the operation room or the hospital of the future to treat oligometastatic people. And in green, you see the small and medium-sized companies. And since the second funding period, we also have 3 non-German companies. It's Orano, Elysia, and GMV. And in blue, you see the big companies which are also supporting M2OLIE. And all these partners came together, and that they can work easily with each other, we need a specific structure of contracts, which is shown on the next slide. So we have 3 different levels. So we have our master cooperation agreement. This was really a very complex procedure to negotiate this agreement, especially 5 different partners were involved in this negotiation, and this master cooperation agreement is signed or was signed by all partners, and each new partner has to sign also this master cooperation agreement when a new partner comes into the research campus. And this master cooperation agreement governs the collaboration of all these partners in connection with the research campus, which is funded by the BMBF. And one level below is the individual work package agreement. So we have 3 different collaborative projects, and each collaborative project has 1 individual work package agreement. This is so signed by the partners which are in this collaborative project, and this agreement is to establish a framework for the cooperation of the partners in each collaborative project, especially the rules of the project, or the rights and duties of the project coordinator are described in this agreement. It's a very small agreement. Much more important is the lowest level, so the work package agreement. So actually, we have about 27, I think, different work packages, and in each work package we have 1 specific agreement, which is signed by only those partners which are working together in this work package. And so they agreed for specific IP regulations, which are then applicated in or used in this work package. And we in the master cooperation agreement, we have the definition of the 4 options which can be chosen for this work package agreement. And then in the work package agreement, the partners decide which of these options should be valid for the next 5 years. And on the next slide, you see the 4 different options which can be chosen. So option 1 is that partners define their fields of technology before starting with the working, and so the inventions which are done in a specific field then belong to the partner which has defined this field of technology. The option 2 is the favorite option of the ministry, and it's a discretionary model of freedom, meaning that in the beginning everything belongs to everybody in a work package, and at the end of the funding period then the partners decide which is be used exclusively by one partner and how much this partner has to pay to the other partners. And option 3 means that the transfer of rights of all project results for annual lump sum is given to one of the industry partners. And option 4 is that only single project results are given to an industrial partner. So the most work package agreements decided option 2. The other 3 are not so often taken by the partners. And then we have additionally a flexibility clause, meaning that if none of these options is really nice for the partners, then they can negotiate again and find an option which is used by everybody. This was only done in one work package, because there we have a specific constellation that the industrial partner gives money for a PhD student, and then they want to use a specific option. But as I said, normally we take option 2. And we have not only these rules, but we have also a specific governance structure, which is shown on the next slide. So we have our cluster management, which is in red. So we are the office, so we have to do everything which is which has to be done in the research campus. So we have to organize the other meetings. We have to write how is it called, documents for the financiers. We have to make marketing activities and so on. And then we have the project committee. This is the committee where the operational work is coordinated. In this project committee, participants of the 3 project groups, so the collaborative projects, are sent to. And then we have the steering committee. It's a more structural committee, so they decide where the big aims of the research campus are located. And then we have the board of trustees, where the for example, the one moment, please. So I'm here again. So the rectors of the university in Heidelberg and Mannheim are, for example, sitting in, and also the mayor of Mannheim is also a member of the board, and somebody else. When you want to see who else is participating in the different committees, you can go on our website. So, and now I will tell something about the aim, so the scientific aims of M2OLIE on the next 3 slides, maybe. So the aim of M2OLIE, as I told already, is that we want to treat cancer patients with oligometastasis. So about 20 million humans with cancer are worldwide this year with cancer, and 500,000 only in Germany. And about half of all patients die due to their tumor disease, but most of them die not due to the primary tumor, but because of the presence of metastasis. So it's a great aim to treat the metastatic disease. And oligometastatic disease means that we have up to 5 metastases in one organ. So we focus on the organ liver and the brain. So we want to treat patients with metastasis in liver or in the brain, not both sides in parallel. And what is very important that the metastases differ due to the genetic conditions. So it's so-called tumor heterogeneity, meaning that they have different gene and protein expression in different metastases. So it's very complex to treat the metastatic disease only with one drug. So we have to treat indeed each metastasis individually. And what is the problem actually if one tries to treat tumor patients with oligometastatic diseases is that we have a very fragmented diagnostics and treatments over weeks and even months until one can say that the treatment is finished. And You can see on the right side a picture below that progression-free survival is indeed increased with the blue curve when each metastasis can be treated individually, and also the overall survival. Please click once on the picture. Yes, you see here now the bold line is that also the overall survival is indeed increased when each metastasis is treated individually, and in this case by a specific radiotherapeutic treatment. But we want to make it even better than showing what is shown here, and you see on the next slide what we want to do is that we really want to detect each metastasis, we visualize each metastasis, characterize and destroy them completely. So we want to get a curative treatment of patients with oligometastasis. And this is done in a so-called closed loop. You can see it on the next slide. So we have patients coming in on the left up. You see the patients entering the hospital. An electronic summary of all information is built up. And then we start this closed loop where the imaging, the biopsy, the diagnosis and treatment are linked to each other at the end of the day. So the patients are released, treated from the hospital. And so we have more than 100 scientific persons working together from different disciplines in this closed loop. And what we already reached is showing on the next slide. When you click once again on this slide, you see that all the different steps can be linked together, and actually we are already at a time frame of only 9 hours for the whole process, although we didn't make it completely once by each other, but separately. And at the end of this funding period, please click again, we want to make a prospective phase 2A study where we really treat patients with oligometastatic disease in our M2OLIE station. And this must be the aim of our actual funding period. And on the next slide, you see the 3 different collaborative projects, how they are linked together. So MIBIT is the project for the imaging, MINT is for the systems for diagnosis and therapy, and M2Data is the great process for the data acquisition, transfer and analysis, where Mr. Schäfer with the company MINT Medical is, for example, located in. And so with the last slide, I want to thank you for your attention. These are the 3 persons of the cluster management or administration office, and especially Ulrich and M2OLIE were talking with us 3 for organizing this meeting today. So thank you very much.
Thank you very much, Professor Meyer. A very interesting presentation and a lot of food for thought and reflection. And I think those of you who have questions, please remember them, because we will take all the questions and in the discussion and exchange of experiences at the end of the presentations. So now I will give the floor to Dr. Elmar Bourdin, who is the manager of Mannheim Medical Technology, who will explain more about this collaboration. So over to you, Dr. Bourdin.
Yeah, thanks very much. Good afternoon. According to the schedule here in front of me, there are 5 minutes left for Dr. Schäfer's and my presentation. Is that correct?
We can give you a little bit more.
All right. So I try to do it in 4 minutes. I will share a quick presentation while continuing to talk. I understood my task here to introduce you a little bit to the medical technology and life science specific environment. And I will walk you through a couple of slides, not too much detail, but just for you to get a little bit of flavor of the overall industrial, scientific, and healthcare environment here in the greater Mannheim area. Can you see the presentation?
Yes.
Yes.
All right. Good. First and foremost, please accept my apologies. This is a presentation that I usually do for American investors. So sometimes you need to explain to them where Germany is. That's the purpose of that initial slide. But then talking about the greater Mannheim area, Mannheim itself has approximately 100 companies that are involved in medical technology in a very broad band of technologies and applications, and across the entire value chain. Our geographical scope does not only include the city of Mannheim, but also everything roughly 1 hour car drive around. If you look into the industrial landscape in medical technology, in that oval scope, you end up with a lot of companies, and if you pull out the biggest companies among them, it becomes kind of obvious that a large piece of not only small and medium-sized companies, but also a large piece of global corporations have subsidiaries here or headquarters or satellite offices. We truly believe that the availability and access of patients, of physicians in a very broad span, so that you find the cohort of the disease that you target in a sufficient quantity, and also sufficient quantities of the specific state of disease. We believe that it is of utmost importance to have access to large hospitals. And if you look at the region, there are a lot of hospitals, but just the biggest 6 hospitals in a radius of 15 kilometers include more than 6,000 beds, among those 2 university hospitals. It's also interesting to note the number of clinical research organizations based in the area here. It's a nice indicator for the industrial research effort in the area, because I believe there must be a good reason why they are based out of here and not based out of somewhere else. This is very specific. It is a quick introduction to the simulation capacities. We do have here in the greater area 3 companies who provide simulator training with medical devices, and 2 out of these 3 are also building the simulator. So being a manufacturer of a medical device, you can ask them to build the simulator for in servicing and train your physician users. This is a little bit the general advertising slide, showing a little bit the scientific landscape in the area. I will not step too deep into that one. What I find a little bit more interesting is this slide here. We made the experience that particularly startups and small and medium-sized companies, but also larger companies who stretch into the medical device market, usually struggle with a couple of key issues, which include access to the statutory reimbursement system so that you get your product paid at the end of the day, regulatory product approval, clinical assessment, and also questions of how do I validate my new product development step by step in clinical routine practice. And we have set up here for the area a panel of experts who assists particularly startups and small and medium-sized companies very early on in these critical questions, and we subsidize also the honorarium for these experts for startups and medium-sized companies. Then there's a pool of academic institutions who produce talent to feed the medical technology and life science machine. And this is something that we offer to those companies who have an existing product, who have existing operations in their home country, and who stretch sales operations to Germany and Europe. It's a ready-to-go sales office that basically covers the entire back office logistics and procedures, and you can focus with low resources and low management time to actually sell product to your customers, and you keep your fixed cost low as long as you do not sell anything on the front end. You do not create logistics costs at the back end, and if you sell a lot, then you have also a lot of logistics. So your organization and your investment is breathing with your sales success, which keeps your overall entrepreneurial risk when internationalizing into Germany or Europe relatively low. And then just two more slides about the innovation infrastructure. Professor Meyer has mentioned it in the very beginning. We truly believe that innovation can be accelerated if those who use the product and those who develop and produce it are basically in one and the same room, as long as they can, ideally every day. And we have tested that concept in 2015 when opening Cubex. It's a 1,800 square meter startup and competence center for medical technology. It hosts startups and satellite offices of SMEs. It also hosts one of the core facilities of the research campus M2OLIE, and it also hosts a Fraunhofer research group for automation and robotics in medicine. And it is literally embedded in the University Medical Center. So we have tried to realize the idea of having clinicians, entrepreneurs, researchers, and startup entrepreneurs under one roof in such a specific facility. And the pilot was successful since 2015. It's fully booked. There's also a fully operational experimental hybrid OR included, which you can see on this page here. And once we were able to observe that the concept works, we decided to make everything 10 times bigger, and which brings us to the Mannheim Medical Technology Campus. So here on the picture, You see in red Cubex 41, the pilot, if you want, the pilot of the concept. And as this was successful, we decided to make everything 10 times bigger, which is the Mannheim Medical Technology Campus. That's the entire area with this red outline. Obviously, clinicians, researchers, and entrepreneurs and startup entrepreneurs are no longer under one roof, as it was in Cubex 1, but at least they can reach each other in a walking distance with a cup of coffee. So that's a little bit the very quick, very rough snapshot about the industrial structure in medical technology and life science. Thanks.
Thank you very much, Dr. Breton. It was interesting also to learn about the broader landscape on the industrial side and, of course, also on the research side. We are going to speed up just a little bit, but what was important for us was also to have one of the companies involved in M2OLIE represented, and therefore I'm very pleased to give the floor to Dr. Sebastian Schäfer, who is the head of research and development from MINT Medical. Over to you for a pitch on that.
Okay, thank you very much. So can you see my screen? And
yes.
You can hear me loud and clear?
Yes.
That's good. Okay. Yeah, thank you for being invited to this meeting. And thank you for the introduction. As already been told, I'm working with MINT Medical and I'm supervising the research and development activities of the company. I'd like to talk about the opportunities of a cooperation in a research campus like M2OLIE, with special focus of an SME. But first, I'd like to share some information about the company and the product. So MINT Medical was founded in 2010 as a spin-off of the German Cancer Research Center. It is an independent and owner-managed company. We are located in Heidelberg, at least the headquarters, which is roughly 15 kilometers away from the campus in Mannheim. So it's quite close. And there's also a US branch located in Hamilton, New Jersey. But the complete software development of our product is done in Heidelberg. And we are a bit more than 50 employees driving the growth of MINT Medical amongst software developers, doctors, clinical trial experts, and business experts. Our mission is to enable data-driven radiology, to solve communication problems which happen in daily clinical and radiological routine, to transform radiological images to data and data to knowledge. And we'd also like to be an innovative long-term partner for our customers, but also for our project partners. And our main philosophy is to leave no data behind on the medical image. So MINT Lesion is the product of our company. It's a software radiology platform combining guideline-conform structured reading together with image viewing, so image viewing at the medical images and the annotation of those medical images. It is also a certified medical device in Europe and the US, CE cleared since 2010 and FDA 510K approval since 2011. As I already said, it's a diagnostic tool in clinical use, but it's also a software platform for early and late phase trials, generating data accepted by the FDA and the EMA. And data reviewed in MINT Lesion has already supported multiple drug approvals. Our first phase 3 data submission to the FDA was in 2012 with one of our customers. So far the introduction to our company and what we do. Now I'd like to get a bit into the details of the cooperation between M2OLIE, the M2OLIE Research Campus and MINT Medical. So briefly, a short history. Since 2016, where MINT Medical joins as a partner, the 16th partner. In 2018, in April, we were then involved into the application for the second funding phase. As Patrick Meyer already mentioned to you, there were different phases in M2OLIE. In September, there was the declaration of commitment from our side. And in 2019, the grant application was finalized with our partners. And in June, there was the official start of the second funding phase. And MINT is involved in 2 out of these 3 inner projects of M2OLIE, so to say, and also receiving funding in the second phase. And in April 2020, we joined the Industry in Clinic platform initiative. So our contributions to M2OLIE, I'd like to sketch them really in a rough detail in these 2 sub-projects we're a member of. The first one is a more workflow-centric one. It addresses this closed-loop process, and it addresses the special application of a tumor board where interdisciplinary experts meet and try to find the best decision for each patient. And we'd like to enhance this collaboration aspects in the research campus by the aggregation of relevant data, documentation of the process and the decisions, as well as background assistance with guideline information or information of the clinical pathway of patients. The second one is more data-centric. It addresses the analysis of medical images. And within the research campus, you've already heard that there are many different modalities involved, image modalities involved, which need to be acquired, and these need to be prepared to be used in a tumor board, to be used for reading by the physicians, and also they need to be analyzed for quantitative parameters and to make in turn the diagnostic decision. And this is something we tried to facilitate in this work package. But overall, in more general, MINT is working in a very regulated field as a producer, as a manufacturer of a medical device, and we can help the campus with background knowledge on how to bring clinical routine solutions to the market, as this is what we do day to day. And on the other way, what do we receive back from M2OLIE? So first of all, there's the possibility for interdisciplinary collaboration. Also outside the field of radiology, where we are kind of home in. There's access to expert knowledge, in particular in different medical domains and how these medical domains work together. And this comes in handy for us because we'd like to extend our application to such multidisciplinary clinical applications and requirements. In practice, this means there are regular meetings in working groups in both of these sub-projects where we discuss ideas, where we discuss solutions for the research campus. There's an annual retreat for 2 days to gather, plan, and exchange ideas. Well, there hasn't been a retreat for this year, unfortunately, but I hope next year there will be the next retreat. Where we have really 2 days time where we can exchange and form this campus. Then there's an annual test run. There has lately been one to assess the overall performance under a realistic setting. This also enables us to try out prototypes, prototypical applications, how they perform in a realistic environment. And there's a weekly research seminar to discuss topics in detail, where we really focus on one aspect of the research campus. So why should an SME participate in a research campus like M2OLIE? Well, first of all, it considers the needs of medium-sized companies according to their business model. Patrick Meyer has already mentioned a few points, and I will again focus on these a bit here, so I can make it a bit quicker, I guess. And it aligns with the different exploitation strategies, so that we also can bring the results from the research campus to the markets as quickly as possible. Yeah, and as already been mentioned, there are different ways on how the work results from the different work packages can be used, and there are these 4 options, and I think those blueprints are really good to have. It's very good to have these different blueprints for the exploitation strategies, because it paves the way into the cooperation, especially when industry partners are not yet known to each other. So it builds a certain way of trust between many partners, especially the different industry partners. And of course, there's also the possibility to have a fully flexible way, but we, as already have been mentioned, also chose amongst all our different work packages this BMBF model of freedom, because it enables basically every solution by this 1 year negotiation period. And once this negotiation period is over and everything has been cleared, or even in the case the negotiation somehow failed or was not productive, then the copyright owners of the material they produced are free to use their results. At least these are the results they produce. So it gives freedom, but it also gives a certain way of certainty to have the right to use the own work results. Okay, yeah, I guess that's that finishes this talk. Thank you very much for your attention, and I'm happy to answer questions later on.
Thank you very much, Dr. Schäfer, for a very interesting and also very concrete presentation on your involvement in M2OLIE, and of course about MINT Medical. Now, I would like to thank, first of all, the German speakers. We have also invited Professor Jakob Fogh Bengtsson from Aarhus University to give just a short pitch, since this is a two-way dialogue, and maybe this can also be the starting point for our discussion and exchange, which will be a little bit shorter than planned, but that's how it goes when you have a lot of interesting talks on the table. So I will give it over to Jacob, and then after that we open for discussion and questions.
Yes, thank you very much, Ulrik. Thank you very much for some wonderful presentations already. I trust you can hear me and also see what I want to show here.
Yes.
Okay, so in the interest of full disclosure, I'm merely a simple researcher from Aarhus University. I don't have a broad overview of, I'm sure, the many ways that our institution and other institutions in Denmark work with industry, but I have some personal experience with some of these collaboration, and I also have, I want to describe a new platform that was just developed at Aarhus University, Open Discovery Innovation Networks, that I think works very well for basic researchers like myself in collaborating with industry. So how do I, let me see. Yes, just to provide a little bit of background, we are researchers interested in the development of atherosclerosis, how atherosclerosis causes thrombosis that cause heart attack and ischemic stroke. And our special interest in the field of expertise is how a certain population of cells in this very common disease works to move forward, to progress the disease. And over the years in this research field, we've of course developed some knowledge, some new models, some materials that we use to forward our own research, but which has also from time to time been interesting for industrial collaborators. And we could, of course, just focus on doing academic research, and we do that, and we get our funding for this from various non-profit organizations. But over the years, we've been very interested also in working with industry, and we've done a number of studies, including a new study that we're starting now with the large company Novo Nordisk in Denmark, within this framework of open discovery innovation networks that I'll explain to you a little bit. During the years working with industrial collaborators, of course, as an academic researcher, you get to think why you like to do this and why maybe you don't like to do this. And I compiled a short list here of reasons to work with industry and also some reasons not to do it. And I think from an academic viewpoint, and also if one tries to really facilitate these kinds of collaborations, I think it's probably also important to think about what's in it for the university researchers that has a lot of opportunities and why should they go in this direction. And I think for me and most of my colleagues, certainly the possibility to contribute to something, to make yourself useful is certainly a great incentive. In the medical field, of course, we know very well new therapies for patients are not developed by universities, they're developed by pharmaceutical companies. And if you can bring some of the things that you know into play with drug development, I think that's very exciting. Then, of course, there can be other incentives. I don't want to go into detail so that we also have time at the end. But certainly there can also be some deterrence as an academic researcher to embark on industry collaborations. And I think especially overall things that you feel kind of violates your academic autonomy or freedom is something that certainly is a deterrent. Also, most university researchers, I think, including myself, we are not so fond of IP considerations, lengthy negotiations. We don't like secrecy so much. It's in our DNA really to share the things that we do. And I think if you're able to strike a good balance with these motivations and deterrence, you can really engage university researchers in industrial collaborations. And I think this new platform at Aarhus University really has done a good job of doing this. And I can say this because I played absolutely no role in establishing it. It was some of my more forward-thinking colleagues that started this, funded by the large foundation in Denmark called the Novo Nordisk Foundation that also owns Novo Nordisk, or part of Novo Nordisk and part of Novozymes. The aim of this platform is to fund collaborations between research groups at Aarhus University and companies. Any company from Denmark or abroad can be part of this. The theme has to be drug target validation or biomarkers. And the rules then in this funding scheme is that the funding which originates from the foundation can only be used for university research, and companies must fund their own contributions. I think a special thing about this platform that I think works well is that there's no IP considerations, because there's no IP generated in the projects. Everything must be made public in these kinds of projects. All data has to be shared with everyone, not only the commercial partner that you're working with, but also potentially its competitors and everyone else. But of course, this doesn't mean that it cannot lead to anything that can be commercially protected, because these are projects that are more fundamental. They're pre-competitive types of research. And of course, then based on this data, then you can work further on them in a closed IP settings, either a collaboration with university and companies, or just within the company or within the university. The framework is that you get together, you generate some ideas, you seek out your partners, you write an application, and it's granted or not granted. And I'd just like to show you here in the last slide just an example of how it could work with a project that we just got funded through this platform. I have a great colleague who's a human geneticist. She's very good at finding genes associated with the development of atherosclerosis. We have expertise in finding out how these genes work in smooth muscle cells in atherosclerosis. We got together with the company Novo Nordisk. They were interested in finding out whether some of these mechanisms that could be identified could be potential targets for therapies. And therefore, this project will end up, we'll see if we can find some new drug targets for atherosclerosis that companies can take further. All data will be public, and it starts soon. And anyone interested more in this Odin platform, it can be found on this website. It's open for every company around the world. So yeah, that's what I wanted to share. Thank you.
Thank you very much, Jacob, for Benson, also for sharing your thoughts on both the upsides and maybe the challenges when working together between the university and private companies. So thank you very much for that. And now I would actually open the floor for discussion and input. And I will also invite Sonali, my colleague, again to join me with this. You can raise your hand if you have a question or comment. Then we would be happy to invite you to speak yourself. While you think, I have maybe a question myself, and that goes to Professor Meyer, who gave the first presentation from M2OLIE. And my question is, what does this partnership allow you to do in terms of research that wouldn't be possible if you didn't have these industry partners involved?
Yeah, because the industry partners give some machines and also the rights to use these machines. And for example, Siemens allows to manipulate one of their machines, which wouldn't be possible without this cooperation. And also, it's very interesting for the industrial partners to work together, because in a normal joint venture, only maybe 2 industrial partners can make a project together. And in our case, more than 2 companies, for example 4 or 5, can really have a project together with academia. And because the research project is such complex, without all these partners, it wouldn't be possible to make really progress in this field.
Thank you.
All right, we already have questions lining up, which is a good sign. Jacob, you can go first.
Okay, thank you very much. So with M2OLIE, it's a question for Professor Meyer. With M2OLIE, I was very impressed that this seems to have one common goal, even though there are many sub-projects and many companies working on it. So how is this organized in terms? How do you determine which projects can be part of it and which cannot? Who are the persons making these decisions?
Yeah, it was not so easy. So, but in the beginning, we had only 8 partners, and they decided what to do. And then in the following years, then some group noticed that, okay, in this field I have too less expertise, we need an additional partner. And then that additional partner joined the research campus. And so the first increase in partners was done. And when we started to think about the project for the second funding period, we had several meetings over half a year at least, where they discussed which topics have to be continued and which topics are not very successful and therefore have to be excluded for the next funding period. And so in these discussions, then we really find out which are the research fields for the next 5 years, and then the more detailed plans were then done in the groups of the respective collaborative projects, and also below in the groups of each partner which gets the money, and they decided which projects or which was the content of each project. Yes.
Thank you.
Thank you. There's a question from Erik Bisgaard Madsen, who is from the Faculty of Science of University of Copenhagen. Erik?
Thank you. In fact, I have questions for all 3 of the presenters, but I'll start with Professor Meyer. Could you elaborate a bit on the funding structure? I understood that you're funded by the Federal Ministry of Research since 2013, I guess. But what are the payments from industry in this? And my second question is on IP regulation. You mentioned that you had this in your working package agreement. Are you running only upfront payments via lump sums, or do you have a license policy? Thank you.
Okay. So the funding is in the discussion before we sent the application for the next funding period, for the second funding period. We agreed that mostly the academia partner will get funding and not the industrial partner. Only medical is the only industrial partner who gets funding from the BMBF, and all other industrial partners have to bring their own money for their specific projects, and so we get, as I told you, 2 million euro in cash by the BMBF, and all partners have to bring in an equivalent in this 2 million euro together for the personal fees, for machines and something else. So altogether we bring in each year 4 million euro per year by BMBF and by all partners in different manners. And the licensing, it would be good if we have lots of licensing, but I must be honest that the inventions were not as much as we maybe expected at the beginning. So as I told you, most projects took option 2, and therefore there's I think in none of the projects a lump sum paid at actual times. But maybe in the next years, when more inventions will be done, then we have also licensing fees. Yes. Is this the answer for your question?
Yes, thank you.
Eric, you had further questions for the other speakers.
Can I raise a question for Dr. Burden? You mentioned that startups and SMEs could apply for subsidies. Could you elaborate a bit on that? What will be granted, and is this a competitive situation?
Yeah, thanks very much. The subsidies are on different government levels. There are subsidy programs from the federal state of Baden-Württemberg, and there are subsidy programs on a local level by the city of Mannheim. Our organization is embedded in the Office of Economic Affairs of the city of Mannheim. So if you want, I'm a government official, like the police lady giving you a ticket when you're parking wrong. The subsidies that we direct startups to that are funded by the federal state of Baden-Württemberg have a very, very broad range of topics and requirements, and also a very broad range of total amount of support. So it would be probably a little bit overrunning to go into detail on that level. But in addition to that, we have identified, if you want, white spots on the subsidy landscape in those areas where we believe that are particularly critical for medical technology and life science startups and SMEs. And I have explained a couple of those. Some questions are about reimbursement to the statutory health insurance from the statutory health insurance system, because 80% 80% of medical device revenue is being reimbursed by the statutory health insurance. So if you don't get that reimbursement, you know that the doctor will let this product drop like a hot potato. Another piece is, prior to that, a health technology assessment to bring more evidence to the specific benefit of that product. Another area is clinical studies in a very early stage. Another area is the pure regulatory access. We have, frankly, a very open approach. Any startup and any SME that comes to us and is located in the city of Mannheim will receive this initial funding of 400 euros. It's a little bit like an encouraging ticket to lower the bar extremely to ask these questions. The key challenge that we observe and experience, particularly from spin-offs out of academia, is that those questions of reimbursement, regulatory approval, health technology assessment, market entry are addressed way too late. So we found this to be an effective means and instrument to let people start think in a very early stage about all these critical questions with the support and with the supervision of these experts. And basically, these 400 euros usually are enough for a maximum of 2 hours of initial consultation. And anything that happens beyond that point needs to be negotiated between that expert and the entity that received the subsidy.
Thank you. There's a question from Carsten Hjort from Novozymes.
Yes, thank you. That is for Patrick Meyer and Sebastian Schäfer. Being from a company that pretty often works together with academia, I think the problem that we encounter most frequently, that is simply the disability to reach agreement on IP issues, and that IP negotiations, they are dragging for a very long time before we can reach something that is a fair agreement. But you talked about 4 different options for IP, and you in particular talked about this BMBF discretionary model. Could you put a little bit more words on to what differentiates this model from the way this is typically being handled in sort of academic industrial clusters? And what do you see as the key advantages and the key disadvantages, and sort of what do you see as sort of the success rate with actually reaching a deal when you start talking?
Yeah, I can share my ideas or my thoughts on that. Basically, I'm also not in as I told you, we are a rather small company. I don't have so much samples to look back on where this has been the case. So I think it's always also the question on how mingled things are in these research packages, or in the other way around, how well they are separated from each other. So I think this is also an important point to really identify which of the industry partners is interested in which IP, which is then generated in those work packages. I think this is an important, crucial point on how successful these negotiations can be afterwards. I only see the main advantage here that there is kind of a blueprint. So there's a kind of a general idea on how and when these negotiations shall take place and how this is organized. In the opposite, I mean, you will have to start from scratch in doing these negotiations. And also an important factor to note is that at least in those work packages where MINT Medical is involved, there's usually only one industry partner. I think there's one work package with another industry partner. There are 2 industry partners then involved, and then there's only MINT Medical as industry partner, and this also makes it easier. So if there's really an advantage, if you would say like there's a work package with like 4 or 5 industry partners involved, I'm not sure. And then I would agree with you. I can well imagine that those negotiations will take a longer time, and probably then it's also not so much worth anymore to have these kind of blueprints because there's so much interests involved. So I think we are really having here the situation that these work packages are small enough and there are not so much partners that the IP can be well separated and can be well distinguished from each other. At least that's also my hope. I mean, we haven't yet come to that point where we sit together and say, okay, this is the IP we generated, who wants to sell what? Yeah. But I mean, we have talked about solutions and we have talked about what are the interests of mainly the industry partners, what they want to market, and at least for this work package where we have two industry partners, they are really way away from each other. The interests are really different. And also, especially in this one project, in this workflow-centric project, it's a lot about interfaces. So we are elaborating on interfaces, how we can interconnect different parts from this closed loop to exchange data. And we use open interfaces. So in the end, everybody can use these interfaces and the technology behind this. So sometimes there's probably even not so much IP involved, which at the end we have to consider to share amongst the industry partners. I hope this answers your concerns or your questions a bit at least.
Yeah, thank you.
Patrick, do you want to add something to the same question?
Yeah, the option 2 is also very useful because when you really don't know at the beginning when you negotiate if really in the next 5 years something will be developed which is be valid to be licensed or to be exclusively used by a partner, and then you really can make your research completely freely, and also the academic partner can use all the results for other projects in parallel, or also use them for teaching the students, because all the academia partners are involved in develop or the education of medical students, and then when the partners are at the point that really something was developed which wants to be used by one partner exclusively, then they can negotiate, especially for this topic, and this is therefore very useful for this kind of research, and it's also used not only for work packages where only one industrial partner is involved, but we have also work packages where up to 3 industrial partners are involved, and they also have chosen the option 2.
Thank you.
Okay. Thank you very much.
To Sebastian, Patrick, and Elmar, I don't know if you have any questions to the Danish delegation, if you will. It can be also outside of the scope that we have discussed now, but I just want to give you the opportunity also to ask some questions the other way. Otherwise, we have more questions coming.
Yeah, thanks very much. Indeed, I have a question. When it comes to, so to say, to cooperation between academia and industry on a very broad fashion, it does not necessarily to be vascular science. It basically applies probably to a lot of disciplines. Is the sheer size of Denmark something that that limits this ability to find partners, or do you generally think and manage and cooperate on a broader Scandinavian basis in the first instance?
Okay, I think I would be a little bit afraid to answer on behalf of everyone. So maybe I would invite some experts, and I notice a few who could maybe give their perspective on this, not representing everything, but maybe their own institution. So maybe Morten Dalgaard from Aalborg University. Would you give your input, or maybe Erik Bisgaard from University of Copenhagen?
Sure. So thank you very much for some interesting presentations. So my perspective on this is that I don't see it as a problem that we're a small nation. We have world-class research. We are very much going out to international partnerships. So I don't see it as an issue of getting collaborators. So we don't have that many, we have a lot of SMEs in Denmark, but some of them very small. We have a few in sort of the in the range of big corporates that are also research active, and I think that's maybe where the issue is, that we're very much able to address corporates in Denmark. That's not an issue. They know us and they collaborate with us. But the sort of the broad SME segment here, I think, is very hard to get a hold of. Also to work on, so what is research, and and how advanced do you need to be interesting for a researcher to actually go into a formal research collaboration. I think that's the issue, especially with the Danish companies. I think maybe the SME definition is not good here. We have a lot of small startups, small companies that are very research active, spinning out of the university. But sort of the broad scale of Danish companies, those are hard to get. The large multinational, be they Danish or German or Chinese or American, that's not a problem, even if we are a small nation.
Thank you, Morten, for this. And at the same time, I asked Erik, so I would just give you the chance also to say something on this, if you have something to share.
Just a brief comment. I don't think that's a problem because of the size of Denmark. We have a very international focus and have collaborators worldwide. The University of Copenhagen has climbed the ranking list during the last 10 years or so, and we are now listed between 30 and 60 on different ranking lists in the world. And for example, just to give you two examples, Microsoft and Unilever are also knocking our doors. So I mean, we have a lot of international collaboration and seek for that. I mean, when we are highly ranked on the world rank list, we also need to collaborate in an international scale. Thank you.
Thank you. I don't see any further questions now, but maybe I will just summarize a little bit today's meeting, since we only have a few minutes left. Do you have one more point, Erik?
Yeah, it's in fact a question for Dr. Schäfer. You mentioned that the benefits was interdisciplinary collaboration and access to expert knowledge. Could you elaborate a bit on this access to knowledge? Because I mean, you could knock doors in the universities yourself. I mean, how do you see the benefits being part of this cluster?
Indeed, I can elaborate a bit. So, in general, of course, we can contact also our customers, which are mainly based in radiology departments, and can ask them for reference of colleagues within these other interdisciplinary areas. But here it's the whole setup of this whole closed loop process, because it touches so many different disciplines and also organizational aspects of a clinical environment. And when we have these meetings, if these are these targeted meetings within the different sub-projects, or it is the annual retreat, you have all these experts at one table. And this is a very good situation and a very good opportunity also. I mean, you could try to reach out to those, although I have to say that medical personnel is always short of time. So this is mainly what I meant. You have these experts sitting at one table. You can discuss this, and it's for us. It's especially interesting because it's an interdisciplinary project, and this is something where we want to broaden our application or our platform also to connect other disciplines to our platform, to enter knowledge, to consume information, to enter information, to be part of this whole process of diagnosis and therapy decisions, therapy and treatment in a clinical environment.
Thank you.
You're welcome.
All right. Thank you very much. I think I will close the session here, but also to let you know that we will follow up with I'd like to thank the presenters, and we will follow up with you, and maybe we can gather your presentations in some form at least. And I would also invite the participants here to follow up bilaterally if you have come across something that is maybe interesting, mainly for you in a direct contact. Then you are of course welcome to do so. So thank you very much for participating. And to the Danish side, we'll see you tomorrow at 9:30, also in a new Teams call with the Cyber Valley Cluster in Tübingen on artificial intelligence. So thank you very much for now, and have a nice afternoon.
Goodbye.
Thank you very much.
Thank
Bye.
you.
Bye.
Thank you.